Awesome. Welcome, everybody. Now, the goal with this video is to help you understand why your pain exists and how to appreciate your pain. And how does that make sense? Appreciate your pain. And so your body is trying to help you out with this by giving you pain. And so that's what we're going to dive into. Now, I'm Dr. Burt, and let's get into this. So people can experience pain primarily for three different reasons. Now, there's going to be chemical, toxicity, all these different things can cause that toxic overload, and your body can adapt to it, so it produces pain. Also, emotional trauma, same concept. There's a threshold, and if you get too much of that, you're gonna get pain, and the pain's gonna store in the tissues, and that's why people carry that for years sometimes. And then now what we're gonna be focusing on today is gonna be the physical trauma. Now, these physical traumas, these macro traumas, and even micro traumas, but these injuries will absolutely cause people chronic pain. And unfortunately, nobody is talking about it. And so that's what we're going to do. We're going to talk about it because when the head and neck is injured like this will instantly cause full body dysfunction. And so let's explain what that means. How do you get this full body dysfunction? And we're going to start with this guy right here. Who remembers him? Tell me who it is. Shout his name out. That's right. Superman. This is Christopher Reeve. Everybody remembers this guy. Now, if you don't, I'm telling you, this guy here, he was the star actor in the first 4 Superman movies. Now, what happened to him? Why wasn't there a Superman 5? Unfortunately, because after filming Superman 4, he was riding his horse one day, and just like that, bam, he was thrown off, landed on his neck, his head, completely shattered his upper neck vertebra, which left him completely paralyzed and wheelchair bound. He couldn't even breathe on his own. He had to have the respirator, the machine breathe for him. He couldn't move his muscles, just everything shut down. And unfortunately, as sad as it is, 10 years later, he died. And why do I share this story? Because it directly involves the atlas vertebra, the upper cervical spine. And so again, that's what's going to help us drive through this and help you make sense of it all. Now, a misalignment may not result in this type of paralysis, right? That's a severe, rare injury. But what you need to understand is that whether the atlas dislocates on a major level or misaligns on a minor level, regardless, you're still going to see full body effects with both. And again, misalignment may not result in that full body paralysis, but it will result in that full body dysfunction. And if neglected long enough, that's when your body's going to start sending you those pain signals. Now, what kind of full body dysfunction are we talking about? And so we're talking brain problems, heart problems, thyroid, hormone imbalances, migraine headaches, dizziness, vertigo, neck and back pain. Because what happens is when the neck shifts out of alignment, the whole back and spinal column will lock down and go into a spasm. And then again, if neglected, you'll start to see the bending and the twisting, the disc bulging, and all of that will sacrifice itself to protect what's most important at the level of the neck. And so many different symptoms can come up based on the neglection of these old neck injuries. Again, these traumas are really hard on people, and so it's really important to get it addressed. Now, it's rare that people just come in with migraines or only neck pain, because most times people, they've got a lot going on. They've got the migraines, but their neck and their back also hurts, right? Their thyroid's off. You see it on a lab test. The heart, it palpitates, but sometimes you check the EKG test and we see it completely normal. And so again, all these different tests, we try to figure out this dysfunction, which again, if you ask me, it's the wrong way of thinking. It can be right. There's definitely times, but a lot of people abuse the medical system, and they're not looking for these small nuances, especially as it relates to the upper cervical spine here. But listen, this is how that most times people think these problems are separate. And that's false. And that's where we're going to offer that different perspective, because I'm telling you, all these different conditions, symptoms, body parts, it's all connected to the brain. And that's where the messages start. That's where life starts. Everything goes from the connection of the brain. Now, the take home message is this, if you've got the brain, you've got the body, and now the door in between the two is the atlas vertebra C1. So we got to make sure that's opened and clear. Now, the question that comes up is, can this problem be fixed? And the answer is absolutely yes. And that's my job as a neck specialist, is to figure out exactly how the atlas is misaligned and then figure out how to gently realign it. And so that's what we're going to talk about. And that's why I'm going to do one of these quick, we'll do a case study. So that way it helps you kind of just pair that story up with this. But we'll look at one of my migraine patients that started with me in January, and we'll just kind of explain her journey and how we were able to help. Now, with this case, let's jump right into it. Female, 33 years old, lawyer. She had migraines, ear ringing, ear fullness, head pressure, head fullness, pain between the shoulders, and then also an odd pain into her foot. Now, how is this situation interfering with her life? Well, I've got chronic migraines, so it affects everything. It's hard to work, hard to look at the computer, handle stress, travel, exercise. When did the migraine start? 10 years old, a lot of years of living with migraines. She's tried multiple medications, acupuncture, chiropractic, massage, PT, physical therapy, and trigger point injections. Okay, so with that being her story, what did I do? Well, what I do with everyone. And so we took a few pictures of her atlas to see if it was misaligned. Simple concept, right? You shift out, you're going to see problems. Now, that's what we did. There they are. You can see the two that we took a few more, but these are the ones that'll help make sense of all this. Now, the one on the left shows us if her atlas is tilting, and the one on the right shows us if it's twisting. So a few different axes here. And what do we see? 1.6 degrees on the left with that tilt, and 4.4 degree twist on the right. So there it is, right there. And that's what it is. It's just, is that normal? Absolutely not, because I'm telling you, a normal twist is going to be 1 degree. Same thing, more on the normal on the tilt, but that twist is absolutely causing her problems. And, what do we see? We see the migraine come up. We see a whole other host of problems. Some she can feel now, which is what she shared. And then some she might feel later on if she doesn't get this corrected. And so that's what we're here to do. Now, how did this structure atlas, how did it misalign like that? A lot of times people ask me that, and the answer is really, I don't know. Obviously I'm here to tell you that this is trauma related, because you just, the ligaments can't stretch like that and stay like that if trauma isn't, and if it's not caused by that, you're not going to see it. So I definitely know that this is from trauma, some sort of head neck concussion at some point in her life. I'm telling you, because that's not normal. Now, the easiest way to explain how this misalignment can cause a migraine is this. If the blood flow is being choked off by this 4.4 degree atlas twist, do you think the brain is going to be able to function properly? No, no way. There's not a chance. And so what your brain will do is it'll wake you up, or it'll try to wake you up by sending you these pain signals. Sometimes, it's the pressure buildup. Sometimes it's the aura, the light sensitivity. Your brain will wake you up to all this, muscle spasms, so that way you can try and do something about it. But I'll tell you, the sad thing about this is that most doctors want to hit the snooze button and throw out your body's internal fire alarm by prescribing medication, which is never a long-term solution, because you need to get to the root of what's actually going on, what's actually causing the migraine. And so that's what we did here by assessing the atlas. And so how did she respond to treatment? And phenomenal, great. We saw her 15 times, 3 months, and she spent $19.25, and her insurance reimbursed her about 40% of that. So that's obviously great news when we find that our people are getting reimbursed. But I will say, at this 3 months, I had her fill out this progress eval, and we had a great summary, right? We noticed the change. We noticed a long-term change. We had a 90% improvement in migraine severity. And as much as I'd love to say this fix happened overnight, it didn't. We had a few obstacles along the way, and that's why it took about 3 months to get her stable. But I'm telling you, never forget that healing is a process. That's what health is. Health is not an event, it's a process. And you spell out the word health. What are the first four letters in the word health? Heal, heal. So I'm telling you, health is your ability. It's your body's ability to heal itself. And health is directly proportionate to how well your body can heal itself. And so that's what health is, and just how well your body can heal itself. I know I said that multiple times, and that's just so important that people understand that, because I'm telling you, pills, lotions, and potions do not help with healing you. In fact, they actually cause you to heal slower, because now your body has to process a bunch of lab chemicals while also trying to coordinate the healing effects. And so now your body has two jobs instead of one. And every time you do this, your body is going to be working double time. Now, I get it. There is a time and a place. It might get you through the day. It might help you fall asleep. But again, no, it's not a long-term solution. And your body's going to have to work extra hard at it. Now, I say this all because this is the primary obstacle we faced. And what was it? For blood pressure medication. She also had high blood pressure. She didn't really mention that, at least in the subjective part of the form. But guess what happened, though? Her medical doctor prescribed it to her. Again, standard process. That's great. Obviously, that's what they're there to do, because you check it in the arm, and what does the reader say? It's probably high, 140 over 90. You don't want hypertensive episodes, anything like that. So you give someone the medication. I get it. Now, guess what the doctor didn't do, though? Explain to her and figure out why her blood pressure was high, what was causing it. And so that's the idea. And that's what I try to help people understand, and really challenge that idea of, why is my body doing this? And let me tell you something. If the brain, the most important organ in your entire body, is not getting enough blood flow, what do you think it'll do? It will increase it. It'll increase blood pressure to get more blood to the brain. Just such a basic concept that gets just overlooked all the time. And now you ask the question, why would the brain not be getting enough blood? And exactly, it's what we just talked about. Her atlas is twisting 4.4 degrees. That's a massive problem. And think of it like this. What would happen if you're watering your garden and the hose just got kinked? What's going to happen? The amount of water is going to decrease while the pressure increases. And so that's what you're going to see. But now stay with me here. Think of it like this. When the brain increases blood pressure to nourish the brain, and you take a drug to lower it, how do you think the brain's going to feel? It's going to be pissed off, because it increased the pressure and the blood pressure for a reason. And you took a pill to change that, to trick it. Again, I get it. There's a time and a place, but my point is this. After we realigned her atlas, what did we see her blood pressure do? It went down naturally. And so that's what we're talking about. Now, what was she still doing? She was still taking the medication. And so needless to say, we had some issues regulating the pressure gradients going inside her brain, coming back. And so you see the pressure buildup change. And so once she started to change and lower that dose, she chose it. I didn't tell her. This was, guided by her medical doctor too. And she made the decision to do it. So, don't tell me that I'm telling people to get off meds. That's their decision. But again, you educate people on the philosophy, and they can make those decisions. And so what did we do? She chose to lower the dose, and that's when we started to see her stabilize. And so I know this was a lot here. We're going to wrap up here, but here is the moral of the story here. This is what the takeaway is. I want you to understand why your body is reacting the way that it is sometimes. And your body is much smarter than any doctor, is much smarter than me. And, we've got to understand that and accept that. And we've got to figure out the reasons why your body is going to experience pain. Because again, coming back from the start of this, your pain is trying to help you. It's your body's fire alarm to tell you, hey, we got to do something about this. And you just listen to it, don't numb it, listen to it. You can numb it for a little bit, but know that you've got to figure out what else is going on. And so that's the point of this video. Hopefully this 10 minutes has been valuable and just giving you a different perspective on how to appreciate pain, and just always know your body's trying to help you. And if you're not noticing health results with what you're currently doing, then I'm telling you, look closer to the brain, because too many people are walking around out there with misaligned atlases, twisting, tilting, and relying on medication to solve their problems. And let me tell you something, you're never going to fix a structural problem with a chemical solution. It won't happen ever. And so that's how they've engineered healthcare. Well, sorry, I misspoke. It's not healthcare, it's sick care. And they designed it to get people to take a pill every day for the rest of their life. And when the pill stops working, well, then the surgery should help, right? And trust me, I see those surgeons, they're sharpening their scalpels as we speak. And I say that not to promote fear. I'm being realistic, because I've heard the stories countless times. I get pissed patients coming in, why'd nobody tell me about this? And you deserve the truth, and you deserve how healthcare should work. And I'm in the industry. I know what goes on behind doors. And all right, enough. I'm done ranting here, but hopefully you get the point that I'm trying to emphasize here. I take this stuff very seriously. And by all means, if you have questions, shoot me an email. Look at my website. I've got YouTube out here. Obviously, we're uploading this to YouTube. Read my Google reviews. It's all there. So I just want to thank everyone for listening, and always challenge the status quo. Ask questions, even me. Challenge me. Make sure it makes sense to you. And that's all I got for you. All right. Take care, everybody.